Well, hello friends, and welcome back to my channel. I'm Dr. Via Vicencio. I'm a fellowship trained endocrinologist, and today I'm going to be talking to you about adrenal fatigue. The term adrenal fatigue is used by a lot of holistic and functional medicine providers to describe an alleged condition that is caused by chronic stress, which leads to the failure of adrenal gland function. Today, we're going to explore whether or not this is actually a true condition and whether or not the treatments for adrenal fatigue are helpful or harmful. So let's start by talking about what the adrenal glands are. We have two adrenal glands. They are small and pyramid shaped, and they sit on top of the kidneys on either side of the body. They function to regulate the body's adaptive response to stress, as well as the maintenance of body water and the balance of potassium and sodium, as well as the control of blood pressure. There are two anatomic regions in the adrenal glands: the medulla, which produces epinephrine and norepinephrine in direct response to the sympathetic nervous system, and the cortex, which produces aldosterone, cortisol, and DHEA, which are produced in response to the hypothalamic pituitary adrenal hormone regulation, or the HPA axis, as we call it. So you can think of the HPA axis similar to like the thermostat in your house. When the temperature drops in your house, the thermostat senses that and kicks up the heat, right? Well, whenever the cortisol levels drop in the body and they get too low, for example, if you had adrenal gland failure, then your pituitary gland, which produces ACTH to signal the adrenal glands to make more cortisol, would turn up. It would increase the amount of ACTH that's secreted in order to remedy the low cortisol and then get it back up to where it should be. So if you did have adrenal gland failure, primary adrenal gland failure, you would expect to see low cortisol levels and high ACTH. This is called primary adrenal insufficiency. So what is the difference between adrenal insufficiency and adrenal fatigue? They sound so similar, but whenever a medical doctor uses these terms, they're actually they're meaning two different things. Adrenal insufficiency is a real medical condition, and it's a very serious one. It's when the adrenal glands cannot produce enough hormones. It can be caused by either failure of the pituitary gland to signal to the adrenal glands to make enough adrenal hormone, or by a failure of the adrenal glands themselves, and can be clearly diagnosed by blood levels of cortisol at 8 o'clock in the morning is the standard time whenever we check that, or with an ACTH, or sometimes known as cosentropin stimulation test. On the other hand, adrenal fatigue is not accepted by most physicians, and it is not recognized by the Endocrine Society. There are no tests that can be used to detect adrenal fatigue, and the label is often given based on symptoms alone. Although frequently various forms of cortisol assessment, often those not endorsed by endocrinologists, are implemented in clinical practice. So, real or not real? That is the question. There was a very great study to help us answer this question. It was a meta-analysis published in BMC Endocrine Disorders that reviewed the results of 58 unique studies that looked at the adrenal axis with cortisol profile and fatigue as the primary outcomes. Some of them did show increased levels of cortisol, which is like the opposite of what you would expect with the theory of adrenal fatigue. A few of them showed decreased levels, but the majority of the studies showed no difference between cortisol and ACTH test measurements in fatigued versus controlled patients. So the verdict is that there's really no scientific evidence to support the notion that adrenal fatigue exists. And also, it really just doesn't make sense. I mean, if you think about it, like, our bodies are so incredible, and they have this incredible way to adapt to stress that we put on them and different things that we encounter in life. For example, if you lift weights regularly, you expect to get stronger. Your muscles are going to get larger, they're going to hypertrophy, and they're going to become stronger. If you study every day and you consistently go over facts and read and things like that, you're going to strengthen those neuronal connections, and you're going to recall those facts quicker and easier. You're not going to become more forgetful by studying more. That's kind of like what adrenal fatigue is saying. If we use our adrenal glands more, they're going to work less, when really that's just not how our body functions. So, are the treatments for adrenal fatigue helpful or harmful? The good news is that most of the advice, or a lot of the advice given by proponents of adrenal fatigue, is actually pretty good advice. And it's going to make you feel better, or make most people feel better, regardless of what the medical diagnosis is. For example, a lot of times the recommendation is to give up smoking, alcohol, and drugs, make sure that you're getting enough sleep, have a regular exercise regimen, and reducing stressful situations in life. However, you may be told to buy special supplements or vitamins for adrenal health. The FDA does not regulate or oversee nutritional supplements. Therefore, there's really no way to know if what's in the bottle is actually what it says is in the bottle is actually in the bottle, or how much. And also, the manufacturer does not have to prove safety or efficacy because they don't have oversight by the FDA. Some also may contain corticosteroids, and in some cases, patients may even be prescribed corticosteroids. And what I'm talking about with those are prescriptions for prednisone, hydrocortisone, dexamethasone, and things of the sort. There are two major problems with that. First off, regardless of the condition, corticosteroids tend to cause a sense of well-being initially. However, this is often temporary. Long-term, corticosteroids increase the risk of weight gain, diabetes, osteoporosis, glaucoma, cardiovascular disease, psychiatric disorders, and sleep disturbances. Second, if you take adrenal hormones when your body doesn't actually need them, it can put the adrenal glands to sleep and make them not be able to work properly, or not be able to work at all. Then, when you actually are under physiologic stress and you need your adrenal glands to increase the output of adrenal hormones, they won't be able to do it. So what should you do if you've been told that you have adrenal fatigue? One of the biggest dangers I feel about this diagnosis and labeling of adrenal fatigue that's been going on in the media and in functional medicine providers' offices is that there is a delay of what's the real diagnosis going on. People have real symptoms of fatigue, weakness, and depression. And if you have these symptoms, I would urge you to see your doctor. If there's still any question about whether or not there is a problem with your adrenal glands or with your cortisol levels, then referral to a board-certified endocrinologist may be indicated. But if you have true adrenal insufficiency, that is a real dangerous problem. But it could be other things too, such as sleep apnea, major depressive disorder, and various other things. So definitely get that checked out, and don't waste time accepting unproven theories. Getting an accurate diagnosis is the first step in your road to health and well-being. Well, I hope this video was helpful. If it was, click like below and subscribe. I'm Dr. V with Endocrinology, helping you with all your hormone questions and to find your perfect balance. Until next time, hasta luego.